DG?
I will start. So just very briefly, just thank you very much, Minister, for these very thoughtful comments and concerns raised in this room. Just to highlight the question around surveillance and reporting and testing. So we fully agree on the importance of surveillance and having accurate, validated diagnostic tests. So there's quite a bit of work that's happening at looking at not just the machines, but also looking at the test kits that are available. There's quite some work that's looking at distinguishing between clade 2, clade 1A, clade 1B, and we want to make sure that the right tests are getting to you. So that is a priority of all of ours, to ensure that of the diagnostic tests that are available, they're reaching you. Fully support your comments around if you have cases to report them. This is really critical so that we can look and do constantly risk assessments. These viruses do not respect borders, and so working together remains absolutely critical, as well as utilizing your own sequencing capacity that you work so hard to develop and expand during COVID-19, as RD has pointed out. Looking at the viruses, looking at the mutations is something that constantly requires investment, and that's something we're committed to working with you on. And just to reiterate what Dr. Kaseya has said, that we do not recommend travel restrictions, and we fully recognize that there are some negative consequences to you reporting. We saw that during COVID, and we will work very hard to ensure that that doesn't happen to the best of our ability.
DG.
Yeah, thank you. I will stress the travel ban as we issued a temporary recommendation. So from our side, we don't propose any travel restrictions. So as my brother said, we will reach out to those who are trespassing actually this. Then on EUL, my sister Janet, you said waiting for EUL. No, there is no waiting here, because I said it actually in my speech. The companies haven't provided the full information until last Friday. So it's very difficult to issue EUL without getting all the information from the companies and assessing the information. So all the information came last Friday. It was incomplete before then. And as I said in my speech, we will finalize the EUL in the next, within 3 weeks. It could be even less. So, but even then, we said to Gavi and UNICEF to go ahead and proceed with the procurement. Because from the information we so far have, we don't see any safety problems. So that's the central one, by the way. We advise them to proceed with procurement, and they can proceed, and I hope they have done. Because I had a meeting more than a week ago with the CEO of Gavi, and we discussed about this issue, and that's when we gave them the green light to proceed. So there is no waiting. There was an article, by the way, that was published, I think saying the same thing, but it's not true. I just would like to underline that. It's not true. Nobody is waiting for the EUL. Procurement is proceeding, and the vaccines, as soon as the procurement is completed, they will be delivered. And we're tracking that regularly. And then on, why, this emergence, especially in North Kivu, among others, by the way, security is the problem. And I think you know that. Ebola, you remember from 2018 to 2020, it took like 2 years to stop it. And the security problem in North Kivu fuels the outbreaks. You also remember that within the 20 months of the response to the Ebola outbreak in North Kivu, I have been there myself 18 times. 14 times. within the 18 months actually, 14 times. And I have seen firsthand all the difficulties in North Kivu and all the fertile ground for outbreaks. So it's not just responding to outbreaks, but if you ask me, the best medicine is finding a political solution for the problem in North Kivu that can help us to address not only the health situation, but other issues as well. By the way,